how do you handle mistakes that you may have made with a client?
Okay, so mistakes, number one, it's accepting that you are going to make mistakes, 100%. So kind of getting it out of your head that you're going to be perfect, everything's going to be smoothly. You know, there are things that are going to come up. Number one, seek supervision, always. Also refer to your code of ethics. So it depends on what it is, but if you're referring to your code of ethics, if you're seeking supervision, that's kind of doing your due diligence, making sure, you know, you're given the best treatment possible. And then also just transparency with clients, I feel like works as well. Just being transparent and being just grounded and present with that client. For me, I would say one of the hardest, most difficult client that I'll have is someone who comes in that's truly depressed, and sometimes you don't really know what to say. But just being present in the here and now with that client, reflecting back and just sitting in it with them, you know, that can be more meaningful than anything else. So a lot of times I've left the session and I don't feel like I was helpful, but if you're present, it actually, you know, to the client, they get a lot out of it, and that's really all they needed. So I think that can kind of be helpful when you feel like you're not really given a lot, but just being in the moment with the client.
Okay, I wanted to talk to you about boundaries and what your advice is along those lines is, you know, things like, do you share your cell phone number? Would you ever, you know, call a client to check in on them? Things like that. Like, what's your advice in terms of where to draw those lines?
So boundaries are really important, really, really important. And especially setting boundaries in the very beginning initially, because this field is all about boundaries. In order to be the best clinician that you can be, you're going to have to learn how to really set good boundaries. So for me, I'm working in a private practice because I am scheduling my clients on my own. My clients do have access to my personal number. However, I'm very good about, you know, making sure here's when I'm available during these times, you know, from day one. Also talking to them about the protocol for crisis. You know, if something were to come up and they needed, you know, to talk immediately, if it was a crisis, you know, I refer them to either mobile crisis or behavioral health. But typically what I try to do is if it's something they're really needing to talk, I will try to schedule a session with them very soon, so they know that I'm intentional. We need to get in. We also can't have 2-hour conversations outside of the session, because that's not setting good boundaries. Because clients, you know, they come in and they're in a really difficult place, and they're just trying to like hold on to you like a life raft. So, you know, you have to really hold on to them and not drown them, and that's really helping them set good boundaries.
Okay, that's good. So, Dr. Wilkie, what would your advice be? And you can talk to me directly.
Is it on?
Yeah.
Oh, okay.
Yeah, I can see you, and the numbers are going.
Okay. Usually
okay.
I see a light.
Yeah, no, that's fine. What would your advice be to a student who's just entering the program who aspires to be a therapist?
I'm going to picture me giving you the advice.
Okay.
And I think it's really important to be yourself, to take what you've learned and to somehow build your craft, but always coming from a humble place, a place of curiosity, and always being yourself. You know, this is a really sacred job. You know, anytime we look at being paid to help people and hear their dirty laundry, it's quite a privilege, and we have to treat it as such.
Well, this profession, this field attracts people that are maybe a little more sensitive and might have some insecurities about going into it, or might have some negative self-talk. What would your advice be to someone who might be going through those sort of ruminations and fear about doing role-playing in class and things like that?
Mm-hmm. Well, I think it's always really critical to do your own therapy. meaning your own self-therapy, and to do a lot of ruminations, about that subjugated place from whence you come. And we have asked our counselors to get all the therapy they can so that they can somehow begin to work through any of their baggage, their past messages, their family, should I say, their family embedded thoughts, to work through that and to be sure that they are able to be objective when they are working with their clients, and not to see themselves sitting on the couch, every time someone comes in the door. So I think they have to go to a different place and think of perspective and look at the client's resources, to be separate and apart from the conversation, meaning that they need to be sure that they are giving the client the autonomy, but making sure that they give them choices and not try to ever impose their thoughts based upon or over identifying with a client. Yeah.
Our clients and what they can do for you. How do clients help you personally?
That's a good question.
Yeah,
I learn a lot from my clients. And I feel that my experience and the proven record over the years, talking to clients and seeing what has helped most, is some reinforcement, some confidence building, but it always helps me to practice what I preach. So that when I am giving them homework and suggesting that they look at life from a certain perspective, I do that. I have a lot of exercises that I give them in between sessions, and I have found a lot of joy in doing those exercises myself and trying to think through some of the reflections that I ask them to do. So it is really practice what you preach. Try not to give advice that you wouldn't do for yourself.
That's excellent. That's excellent. This was again, this comes from The Gift of Therapy, the book that we're reading for Dr. Khan's class. One of the pieces of advice was, and I just want to see if you agree with it, is that therapy works best if it's thought of as sort of one continuous session versus putting out the fire of the week or the emergency of the week. Do you have a thought on that, on what you find more effective? Is it about triaging what's going on that week versus maybe one big continuous session?
Well, I think there needs to be a treatment plan.
Okay.
We have to work toward a theoretical approach that works best with that problem, with that person at that time. And so I think the theoretical approach, we try it, and if we see some progress, we continue with that. And if we don't see any progress, we might speak to the client about permission to come from a different angle. But because I do homework with my clients and I want them to try out things, I'm going to have to check in with them each week to see what kind of energy and commitment they've put forward to participate in the treatment plan.
How knowledgeable is the client about the treatment plan? Is this something that you physically print out and give them? Are there weekly goals that are established beforehand?
Well, let's say we are working on quality time together. Okay. And we're talking about maybe a mystery date or a sensory tour. We call it lots of different names. And many of our couples, once they somehow fuse up a permanent relationship, particularly if there are children, they stop dating. And if I ask them when was the last time the two of you went out for some time one-on-one together, they might tell me they haven't done that in 5 years because I don't want a babysitter. So it's very critical that couples get together one-on-one. I mean, that's the whole reason that they form this union or this relationship. And when the children come along, the literature tells us that couples become dissatisfied with each successive child. And so it's very important that the focus stay on the spousal relationship or the relationship itself, because if they don't, that spousal relationship is lost. It kind of falls between the cracks. And so it has to be intentional, with some deliberation. Otherwise it won't work. Lately, particularly during COVID, a lot of my couple clients in my private practice come to me and say they're bored. And they want the other partner to do something about it. And so this is another, going back to one of your original questions, I think it's really important, and I've learned this, that you can't expect the other person to make the change. If you want to effect change, you've got to make the change. You've got to change the way you do something to get something back different.
Great.